Good afternoon, everybody. We're going to go ahead and get started. Erica, you're not on GoTo. I was told you were on GoTo. Yeah. Better yet. Well, welcome, everybody. My name is Ed Desi. I'm the chair of the Region 9 Healthcare Coalition. I also am the Public Health Administrator for Lincoln County Health Department. So I get the great pleasure of working with all of you as we work on our mission at the Healthcare Coalition to improve the healthcare status or to improve our healthcare system and enhance the capacity to respond to assure that patients are treated at the appropriate level of care in the most efficient manner during a disaster. And we all have an individual piece in that in helping to prepare our facilities and our staff so they have the capability and capacity to respond and that our facilities can maintain their operational capability. But we also have the responsibility to make sure that we can integrate with the rest of the healthcare system to make sure that that can happen. And that is why we are here today, so that we can continue those conversations, we can work on those plans, we can exercise those plans, and we can improve those plans. So that if we ever actually have to do those things, and we have to varying degrees in the last couple of years, we have a better understanding on how to do that. So thank you for taking the time to be with us today and help us along with that work. Just a couple logistics real quickly for those of you that haven't been here before. Restrooms are right out the door next to the drinking fountain. If for some reason we do have to leave this building, we do have the main doors that you came in. We've got doors on either side of the meeting room, and I would ask that if we did have to leave, let's gather on the northern parking lot over here so that we can make sure everybody gets out of the building okay. Once we've accomplished that task, then we can probably go on our way as appropriate. So today is really a mental health day. It is the agenda that we had planned for November. Could have been October, it's been a long time. But it was the agenda that got canceled because we had a windstorm that impacted many of our facilities and required us to do many of the things that we're talking about today and that we talk about as a healthcare coalition. So it's a great opportunity to get back to that agenda topic. It did generate a lot of interest. So we're going to go back to that agenda. We are going to hear from Dorothy Sawyer, who is the CEO at Eastern State Hospital, to talk about a lot of the things that they've got going out there, how they integrate with the system, and how we support one another. We're going to hear from Tamara from Providence, who's going to explain and give us more information about the innovative approaches that they're using at Sacred Heart and the things that they're putting in place, the things that they're doing, and how we can integrate with them and how they can support us. Then we're going to take just a quick networking break, just a 5-minute break so that if people need to run out of the room real fast and come back in, you've got that opportunity and don't feel like you have to remain glued to your chairs. But I must say that it will be a pretty short break, so don't spend a lot of time running around because then we want to get back to Joe Beckett and Cherise Pope, and I'm not even going to try to remind myself the title of their agency, and they are going to really update us on a lot of the activities that are taking place on the regional level around mental health preparedness and mental health services. Jan Dobbs is then going to come up and provide us an update and some insight onto our Region 9 Healthcare System Behavioral Response Plan. Did I say that right? Which is a plan that we have in our region to help assure that mental health providers are available in an incident. So that when we need them for either victims, families, first responders, we have access to professionals that can step in and take that role on for us as part of our system. Then we're going to hear from Dave Burns, who may not be here yet, to talk to us about an effort being undertaken by the Medical Reserve Corps. And that's about all I'm going to say because that's about all I know, other than what the agenda says. But Dave is pretty excited about the effort that they've got with the Medical Reserve Corps. It's pretty cool, some of the things that they've got going and a lot of the work that they are doing as volunteers, which also leads to the caveat to say, if you are interested in being a member of the Medical Reserve Corps, please see Dave when he's here, and he would be more than happy to sign you up. So, and that will pretty much bring us to the conclusion of our meeting today. Any questions, thoughts, ideas, concerns? Perfect. With that, I think we'll get going. I'd like to introduce to you Dorothy Sawyer, CEO, as I said, from Eastern State Hospital. And actually, I know Dorothy just a little bit from previous meetings, and she has some pretty good experiences that are of real value to a lot of the things that we're trying to do.